So recently, during a live sporting event, an athlete collapsed on the field and had a cardiac arrest. Thankfully, that athlete recovered and was discharged from the hospital. But unfortunately, we have seen this play out specifically over the last year and a half in Europe, where we've seen multiple soccer players and other types of athletes collapse on the field. And specifically, this has affected young men, right? And that's concerning. It's concerning from a lot of perspectives. And I think that we need to go back and look at what the possible causalities are here. We know that when the coronavirus vaccine was tested by the manufacturers, there was an increased incidence in myocarditis and other cardiac issues in the vaccine study group, specifically in men in their 20s and 30s and 40s. And now we have seen that this seems to be occurring in men several months, maybe even a year later, either after they've had COVID or after they've had a COVID vaccine. And I can tell you that when we were treating active COVID cases, I was very concerned about clotting, and specifically around the heart. And I kept my patients on aspirin, specifically male patients, for 6 weeks after a diagnosis of COVID to prevent clotting. And so now we're starting to see COVID's kind of died down, but what we're seeing is more people have gotten vaccinated. And we look at the group who is having these cardiac events, and it seems to be that there is a correlation, a pretty strong correlation between those who have gotten vaccinated and those who are now having cardiac events. And so I think there's several reasons for this. I think that there's probably some interplay between the spike protein and inflammatory mediators that ramp up inflammation, specifically around the heart and the blood vessels around the heart. I believe that there's also other inflammatory mediators that are going on in the body, maybe not necessarily due to the spike protein itself, but due to other components of the vaccine that can raise your inflammatory cascade. And anytime your body's inflamed, by the way, you're more likely to clot. It's a defense mechanism. The body realizes that it's inflamed, it's injured, it's upset. And one of the ways that it does to protect itself is to sort of wall off or to protect the areas that are sick. And one of the ways to do that is to sort of clot it off and not allow it to get blood flow, where that blood can then make the rest of the body sick. And so, you know, maybe you're finding yourself in this position where you're concerned about your heart. Maybe you're concerned about your boyfriend's heart or your husband's heart or whatever. And you're looking for strategies to say, how can we help him? How can we help reduce the risk that some of these cardiac events are going to occur? And I think there's some things that we need to do or that you need to consider doing. And I want to show you a couple supplements that we use here for our clients who are concerned about this, because there's a lot of things that you can do. There's IV therapies, there's things that you can take orally. There's some detox therapies that I think you should definitely consider. But I want to show you these supplements here real quick. So the first one I want to go over is a methylation supplement. And for those of you who don't understand the concept of methylation, that methylation is a process by which your body breaks down toxins and other types of substances, foreign substances in your body, and helps you get rid of them, okay? So by using a methylation formula, we are improving our body's ability to detox, specifically through the liver. Our liver acts as a filter and it helps get rid of toxins. And this will improve your detox through your liver. The second supplement that we use is Monopure. This is a very high quality fish oil. In fact, if you bite into this capsule, it actually tastes good. It doesn't taste like a fishy fish oil. And we know that omega-3 oils are very good for our heart health. It's good for vascular health. It maintains a healthy balance between our ability of our blood vessels to be able to squeeze and remain viable and remain flexible. And so we recommend a high quality fish oil for our male clients who are concerned about cardiac health. And the third supplement that we recommend is this Z binder. And the Z stands for zeolite. And zeolite is a binder, or what some people would call a grabber. It helps remove toxins from your body. So if we believe that you have a buildup of toxins that are contributing to your inflammatory state, which are then putting your heart at risk of some event, the strategy becomes to lower the toxin load in your body. And zeolite is a very friendly way to do that. It's very well tolerated. doesn't really have any systemic side effects, but it's really, really effective at removing toxins from the body, specifically if you use this over a couple of months. So I had done another video recently where I talked about some other steps that I think could be useful in maintaining heart health when you're concerned about these types of things. And while these supplements can be a good, kind of foundation, a good groundwork to lay, the other things I want you to consider are light exercise. I believe that by exercising the heart, helping it demand more blood flow, you're going to keep those blood vessels healthy. You're also going to reduce inflammation throughout your whole body by exercising. The next step is going to be IV therapy, right? And I believe that there are several different types of IVs that can be beneficial to you. We know that EDTA chelation can help remove toxins from the body. Glutathione is your body's most powerful antioxidant, and it can help correct cellular damage. And then through high doses of vitamins, B vitamins, vitamin C, magnesium, we can help calm the heart muscle. We can improve your contractile function of your heart. We can use anti-inflammatory B vitamins to reduce total body inflammation. And the third step that I think you should consider is the use of ozone. Because ozone is a powerful oxygenating therapy for your whole body. It reduces inflammation, and overall it is a really effective therapy for keeping your systems, all systems of your body, in their best functional condition. When you look at those around you and you consider, are you at risk, or someone you know or love at risk of a heart event? Maybe they got coronavirus vaccine, maybe they had COVID recently and they were really sick. But either way, I want you to consider that there are things that you can do to protect your heart. There are things that you can do that will reduce the likelihood that you succumb to one of these events. And so I want you to have an opportunity to come by Compass and be able to get advice for what you can do to help reduce the likelihood that you suffer one of these cardiac events. So if you're concerned about this, if you're looking for strategies, please give us a call. We'd be more than happy to sit down with you and talk about the methods that we have that can help reduce your risk of having a cardiac event. But I need you to like this video, I need you to share this with a friend, and I need you to subscribe to our page. And then come see us at Compass so that we can help you achieve the best version of you possible.